Hi, Dr. Josie here from FreshSkin Medical Spa and Wellness Center. Just wanted to let you know that I've done a presentation that is going to be available for you to watch, all about comprehensive blood testing and what we really do here at FreshSkin that's so different than your standard internist's office or OBGYN. And I like to call it the deep dive into your health. And I went over in my talk some of the chemistry or the biomarkers that we look at that we think are really, really important to discover. And they will allow us to make sure that if any of these biomarkers are off, that we correct them, usually with a combination of supplements and some lifestyle modification. Because if we can intervene early on, what we're really doing is we are preventing disease. I'm not interested in waiting until you get sick. I would really like to be able to find items that I can then intervene with either supplements or minerals or lifestyle changes and really put you back on the path of wellness so that you don't get sick and that you can enjoy the best quality life that you have coming to you. So if you're interested at all, look forward to my webinar, and also come and find us at 595 Elm Place, and the phone number is 847-681-8821. Thanks for listening.
Hi there, Dr. Josie Tenor from FreshSkin Medical Spa and Wellness Center. Today, what I'm going to be talking to you about is what we do here at the practice, and that is diving really deep into your wellness, not just looking at some very superficial blood testing, but actually looking at what we consider a much more comprehensive view of what goes on within your body. And it allows us to really, really, really go deep into your wellness. So let's begin. When you go to a general internist office, primary care, OBGYN, what they typically run on you is what I consider to be some very standard panels. And the standard panels that they run, and I'm just going to show you some of mine, is here what we see is, your basic white blood cell count and your hemoglobin, and this just tells you, about anemia, for example. Then they'll look at a little bit of your blood sugar. They'll look at your blood sodium or your electrolytes, which gives us an idea about your kidney, a little bit about your liver function, and then they look at your basic cholesterol, good and bad, and stop there and say, hey, everything's fine. You feel good, and so or you don't feel good. Sorry, your blood tests are fine. And so you walk away saying, but I don't really feel as good as I possibly could. So I don't understand why I'm being told that my blood test is fine. And so that's really what we do here is we look at much more, many more biomarkers, and we really look at a few more items to get a better slice of what's going on with you internally. What I like to talk about is biomarkers that really matter. What does this mean? A biomarker is essentially a biological test, and in this case, we're talking about blood chemistry. And a marker it's really that. It just marks or gives us a sign of where you're at health-wise. So let me take you through a little bit of what I think is important, and also to really highlight that over the years, our blood tests do change, and they tend to become a lot worse than they were when we were younger. And so I've often asked the question, do we lose our hormones as we age, or do we age because we lose our hormones? And so I actually think that it's more the latter, because as we lose our hormones, we start to see some deterioration. And I'm going to actually take you through my own blood tests. So I give full consent to share this with the world. And so here we go. Let's have a look at what's happened to me over the ages. So here's sort of the top part is what we would consider, to be much more of that standard panel where you have a total cholesterol. They look at LDL, which is what we used to call the bad cholesterol, and HDL, which is what we consider the good cholesterol. But what's much more important are other biomarkers, and they're highlighted below. ApoB, Lp(a) is an important marker, and then there's something called inflammatory markers, which really look at inflammation. This is a blown up view of that, so you could see the numbers. And so, over the years, my cholesterol started to climb. Never had cholesterol problems when I was younger. And these labs were in 2015. My LDL started to climb, and my HDL started to drop a little bit. Wasn't really happy about that. But what was more distressing was all the red below. So when I first looked at this panel for myself, I'm like, I don't like all this red. And let's look at what all of it means. And I don't like the yellow either, and I want to see a lot more green. So what do these tests really mean? Okay, so ApoB, this is a very, very important protein. And what these are is these are molecules that are, some of it is fat, which would be the lipid, and some of it is protein. And so an ApoB or an ApoB protein, it's really kind of the main core of what's in the bad cholesterol. And what happens is that, I kind of talk about ApoB being like the soldier that marshals up all of the cholesterol particles and like brings it in and starts the process of trying to get it all in your arteries. So this is a bad soldier. We don't want a lot of ApoBs. ApoA, on the other hand, is a protein and fat molecule that I consider the good soldier, because these soldiers, we want a lot of them, because what they do is they march through your bloodstream and they get rid of excess cholesterol that's not necessary. And so having a lot of ApoB is really a good marker. And so we strive to get much more ApoA as opposed to ApoB. And so what's very significant is the ratio. When you look at ApoB versus ApoB, there was a Cleveland Heart study that showed that this was the most powerful predictor in terms of heart disease. So if we can get a very low ratio, then we have a much less risk of developing any kinds of cardiovascular disease or stroke issues. So these are those biomarkers that I say are much more significant than just your basic cholesterol. The other marker is something called lipoprotein A. So this is a particularly nasty guy, okay? It's an inherited protein, and I kind of like to talk about it as being something that has kind of like a little spiral on the end that makes it very, very, very sticky inside the arteries. And so when people have this, and it is inherited, not everybody has it. I, unfortunately, as you saw from my chemistry, is one of the people who has it. This is a much more significant predictor of developing some sort of clot or some sort of thickening inside the arteries. And so also when it's high, there's a three times higher incidence of developing cardiovascular disease. And this is one of those markers that, there are people who, they go to their doctor, their cholesterol's perfectly fine, and then they have a heart attack. And they're like, well, why? My cholesterol was low. And really, what's more significant is if they had this inherited Lp(a), that would probably be more likely to be the cause than anything else. There are two types of chemicals within the body that can really decrease the level of Lp(a). One is estrogen, and having estrogen, it probably explains why women before menopause have a lower incidence of heart disease, and after menopause, that incidence goes up. But we don't know that for a fact because we've not done really clear studies on this. But it's my suspicion that estrogen, if it lowers Lp(a), probably plays a role. And then niacin, which is one of the B vitamins, also, when consumed, does decrease the incidence of Lp(a). The other panels that we like to look at is inflammatory markers, because you can have extremely low cholesterol but have a lot of inflammation, and that's bad. You can have high cholesterol and no inflammation, and that's actually better, because inflammation is really what's fine. When you have inflammation, think of it this way: the inside of those arteries are nice and sticky, and so anything that actually is moving through the bloodstream, when you've got a lot of stickiness to it, then you can have fat molecules that stick, and this is how the arteries get more and more clogged. So fibrinogen is what's called a plasma glycoprotein, and that one is not helpful to have in your bloodstream because it can be transformed into a clot, so that's not a good one to have. The other one is high sensitivity. That's what the HSCRP stands for. High sensitivity C-reactive protein. And this actually is, when it's high, says that there's something acutely has gone on that has made it high. So it is in some cases fairly significantly related to heart issues, and we don't really like to see that inflammatory marker be elevated. Another one is called an LPPLA2, or lipoprotein associated phospholipid A2. That's a mouthful. But what this is, it's an enzyme, and it's produced by these cells called macrophages. And they are, my computer likes to, or my PowerPoints always like to get ahead of me. They actually happen when the inside of a plaque starts to break down. And it can really measure that, there is something happening underneath the thickness that develops as the arteries get more and more hardened. So we really want to do things that reduce the ability of LPPLA2 to be elevated. Another one is called MPO, or myeloperoxidase, and it's another one of these enzymes that's released within the a vascular lumen is basically the inside of the artery, and it's when the white blood cells, these are our defending cells, they get activated as a result of something being kind of sticky or breaking down within the clot. And so it's really a measure that tells us that this thickening within the artery is very vulnerable to breaking off. And what happens when it breaks off is what you hear of when you say that, or when somebody has a stroke or a heart attack. It's this little clot of product that breaks off. And so we don't ever want to see MPO being elevated, because we don't want our clot to be vulnerable at all. Other inflammatory markers are interesting. There's something called ADMA, SDMA, and the ADMA is related to something called an amino acid, which is a building block. Think of a brick house. The bricks are the building blocks, and an amino acid is simply like a brick in a brick house. And these are often elevated when you have, when there isn't a lot of oxygen going through the bloodstream. And so some of the drugs that are given for people who have angina or they have, heart issues, really are trying to get more of the blood vessels to dilate. So when these are elevated, they tell us that there's beginnings of damage within the artery wall. And so the ADMA is very much more specific to the heart, and the SDMA can often be a very early marker that something's going on with the kidneys. So we really like to see these early on when you're younger and follow them to make sure that nothing happens as you get older. So here's what's happened to me after I had some supplementation and some hormone balancing. As you can see, my Lp(a), my prior blood result was really in the 179. And so now it's down to 34. It's still out of range, but it's certainly a lot lower than it was early on. My LDL particle size, and these are, when we look at LDL, which was, remember way back when, the bad cholesterol, what we're looking at here is just the size of the particles. And the analogy I like to give often is, think of a tractor trailer, 3 or 4 tractor trailers on the highway. If they get into an accident, yeah, it's kind of messy, but it's certainly not as messy as if all those tractor trailers were represented by smart cars. So if you have the same length on your highway as smart cars and they get into an accident, can you imagine all those bits and pieces all over the place? And that's really what the particle size talks about. So the LDL particle number talks about having a lot more smaller particles. And so you don't really want a lot of those. And my particle size before hormone balancing and supplements was a lot higher than 111. So I'm getting much closer to where I should be. My HDL came up, which was good, and I've never had issues with triglycerides, which are basically, blood sugar fats in the body. But you can just see that just doing something very simple, taking some supplements, making sure my hormones are restored, has done wonders for my blood chemistry. Here, my myeloperoxidase is completely normal, which is nice and low, 160. LP-PLA activity is 46, nice and low. The CRP is nice and low. ADMA and the SDMA all in the green. So we really do want to see everything green, kind of like a stoplight. You want green, you don't want yellow, nothing caution, and you certainly don't like to see anything in the red. Other blood tests that we run that are significantly important, especially during times of stress, is we like to look at some nutrient panels. So, some of the common vitamins we look into is vitamin B12, folate, CoQ10, vitamin D. I don't have a B12 level here on my panel. But these are extremely important because the higher your vitamin levels, the more you are immune to disease. So that is a really good thing to know. The other thing we look at is omega fatty acids. And so my omega levels were nice and high. Why do we care about omega fatty acids? Well, the number one reason in my mind is because these keep the brain, what I like to say is they keep your brain nice and juicy, and so much more able to recover. The fatter and the juicier the brain, the more it stays nice and swollen within the skull. And so you're a little bit more likely to have good resilience. God forbid you should have some kind of head injury. And often, one of the treatments that we do use for people who have had injuries is high omega-3s. And the higher the better, because it seems to really improve the speed with which people can actually improve from a head injury. So omega-3s are extremely important, and we like to look at them, and we like to make sure that we have the right balance of all the different breakdowns as listed here. Sometimes we, if there has been some concerns about exposure to heavy metals, for instance, arsenic or lead or mercury. So these are tests that we can run. They're not done on everybody because not everybody needs to have their heavy metals tested, but in areas like Flint, for example, there was a lot of concern recently about the lead in the water stream, and so if you think that there's any exposure, we would get that from your history and then run appropriate blood levels. One example I can give you is I have a friend whose daughter loves sushi, absolutely loves sushi, eats it all the time, and she was really worried that maybe she was getting mercury poisoning from eating all her sushi, and so we ran her mercury level, and lo and behold, it was fine. So she could be reassured that all of the healthy omega-3s she was getting from her sushi was not being offset by having mercury toxicity. So that's important. Okay, so to summarize, what we do at FreshSkin Medical Spa and Wellness Center is we go well beyond the basics in terms of your biomarkers or your blood chemistry. We'd like to do a deep dive because our goal really is prevent disease before it happens. And in the case of my blood chemistry, I don't want to have heart disease. The number one killer of women in North America is heart disease. It's not breast cancer. And so it was really important that I get some of my biomarkers under control because I don't want to be a statistic. And so our goal is to prevent disease before it happens. When you have disease, it's a lot harder to manage, a lot more expensive, and it really does impact your quality of life. And our true goals is to make sure that you have the best quality of life that you possibly can have. We only rent our bodies for a very short period of time, and we want to have the best quality that is afforded to us. So I'm sure that this presentation may have given you a lot of questions, and feel free to go back to the beginning here. Feel free to contact us at FreshSkin Medical Spa and Wellness Center if you are interested in looking at a comprehensive blood panel and going deep into your wellness. It's Dr. Josie Tenor here, signing off. Thanks for listening.